Okay, this is the lecture for Chapter 9, Blood, Lymph, and Immune Systems. The blood is composed of a liquid medium called plasma and three major types of blood cells. And so, if you break these terms down, you should be able to figure out what they are. Cyte means cell, and erythro was red, so these are red blood cells. Leuco is white, cyte is cell, so these are white blood cells. And then thrombocytes, thrombo means clot, and cell, and a thrombocyte is also known as a platelet, and its function is to form a clot at the site of an injury. Red blood cells then are the cells in our blood that carry hemoglobin, which is carrying oxygen to the body tissues. White blood cells protect the body against invasion by bacteria and foreign substances, so they're part of our protective army, if you will. There are 5 blood groups, actually. The blood groups that are listed here: A, positive and negative; B, positive, negative; AB, positive, negative; and O, positive, negative. There's actually a 5th blood type called U negative, which is very rare and is found among African American patients and Hispanics. That one was just recognized by the American Red Cross not too many years ago. As far as the most rare blood type, AB is the most rare blood type. Only 4% of the population have AB blood. So if any of you students have AB blood, I would highly encourage you to donate to the blood bank. The lymph system consists of lymph vessels, lymph nodes, the spleen, the thymus, and the tonsils, and it's responsible for maintaining the fluid balance of the body by draining the fluid from the tissue spaces and returning it to the blood. It transports lipids from the digestive organs for use by body tissues, and it carries waste products from the tissue back to the bloodstream. And that's the one that we think about the most, is when our lymph glands swell up because there is a localized infection. And so they swell as they're trying to filter that bacteria back into the bloodstream. So lymph nodes swell when there's a local infection as bacteria accumulates there. So when you have an upper respiratory infection or a coryza, if you remember, you'll feel the cervical lymph nodes in your neck will start to swell and be a little tender to the touch. And that's the reason for that. That is your lymph nodes swelling in trying to eliminate the infection from the area. Our immune system then develops as the body's defense mechanism against foreign invaders. So anything that comes into the body that's not recognized as self is typically attacked. And so I like to think of little G.I. Joes and little tanks that run through our body, and if they don't see a cell that looks familiar to them, they attack it, and that helps to keep the body functioning. So obviously, if you get well, the way I think of this, the most common is if a patient gets an organ transplant, the first thing that we fear is organ rejection, and that's because our little soldiers in our tanks see that organ and they say, you know what, you do not look like our normal cells. It looks like a foreign invader, so it begins to attack that organ. So we have to put the patient on anti-rejection medicine to make sure that the body does not attack that new organ that's been transplanted. Pathology that we see of the blood, lymph, and immune system: anemia is one of the most common problems, and it's a condition in which the oxygen carrying capacity of the blood is reduced. So that, not only that, but the amount of blood that you have is reduced, and so you have symptoms of dyspnea, if you remember, which is shortness of breath or difficulty breathing. Weakness, tachycardia, if you remember, tachy means fast, cardi, heart, so the rapid heart rate. Pallor, again, we've used that term in different chapters, and pallor is an unnatural look of paleness. Hypotension, remember, is a blood pressure consistently or persistently 90/60 or below, and they may have a slight fever. Sickle cell anemia then is one that is very characteristic, because when we look at a slide of blood underneath the microscope, most of the red blood cells should look like this, where I'm circling. It should look donut shaped. But in sickle cell anemia, the red blood cells appear in a crescent shape like this. And this is most often found in patients of African descent. And they have problems with their circulation towards their extremities because the crescent-shaped cells cannot enter the capillary beds of the fingers, the toes, the nose. And so in the winter, when those areas have little blood flow to them already, when we go outside in cold temperatures, they have a lot of pain in their extremities because of that. Acquired immunodeficiency syndrome stands for AIDS, and it is a disease that's caused by the human immunodeficiency virus, HIV, which slowly destroys the immune system. The way that this is transmitted is through body fluids, mostly blood, semen, and vaginal secretions. 99% of the patients will have a detectable antibody within 3 months from infection. And so if someone has been exposed to the HIV virus, we need to wait at least 3 months to double check a HIV test to make sure they haven't seroconverted during that 3-month period of time. So let's say that they had an exposure to a blood spray up to the eyes or into the mouth during a procedure, a healthcare worker. And if they get an HIV test right then, that's not going to be indicative of whether they have HIV. They need to have another one repeated at 3 months and probably about 6 months. Actually, the CDC usually recommends 6 months to repeat that HIV titer because it usually takes 3 months at least to seroconvert. For HIV or AIDS, HIV infection, I should say, it may take 5 to 7 years for mild symptoms to appear, such as lymphadenopathy, which is swollen lymph glands, malaise, which is a general rundown feeling, fever, night sweats, weight loss, and opportunistic infections, such as PCP, which is a specific type of pneumonia that is only found in immunocompromised patients. Allergies, then, are an exposure to an allergen, and they may result in hives. If you remember, the medical term for hives was urticaria, sneezing, rhinitis, asthma, and coryza. And if you remember, coryza is an upper respiratory infection. And so how do we test for allergies? We do what's called a skin test, a skin scratch or prick test. And so you see one here on this picture. And what they do is they take different types of allergens that most people are allergic to, and they'll scratch the skin with those different types of allergens, and then they'll wait to see if there's a reaction. So they'll plot out which one is which on a little paper, and it'll say, like, this is dogs, this is cats, this is dust, mold, mite, pollen, whatever the case may be. And then they wait to see if there's a reaction to that skin test. Now, they typically don't do this if your allergies are treated effectively with just like an over-the-counter medication. If they're not treated effectively and the patient still has allergy symptoms, which can flare up asthma quite a bit, then they do this scratch test to find out exactly what the patient is allergic to. And then we can provide them with a serum that they can go to the doctor's office and get an injection for their allergies once about every 3 weeks, and that will keep the allergies at bay. Autoimmune disease is failure of body to recognize self from non-self. So the body produces antibodies against itself. And so if you go back to what I was talking about, the little army tanks and the little soldiers, this is another example of when the body's immune system attacks. But in this case, it looks at cells that are within the self and it doesn't recognize them and attacks. So examples of this would be lupus and rheumatoid arthritis. Edema is an abnormal accumulation of fluids in the intercellular spaces of the body. We typically see this in the lower extremities or the lower legs of patients. Many of you may have a grandma or a grandpa who has edema, and this can be noted by checking by taking your finger and pushing in just a few seconds on their lower leg, and if it leaves a dent after you remove your finger, that's called pitting edema. But edema can occur anywhere on the body. Hemophilia is known as the bleeder's disease, and it is a hereditary disorder, so a patient is born with this. It most often affects men, and it is a disorder where the blood clotting mechanism is impaired. So these patients, if they injure themselves, can bleed profusely for a good amount of time because their blood doesn't have the ability to clot at the site of an injury. So they can become anemic from this as well. Infectious mononucleosis is also known as the kissing disease. It is an acute infection caused by the Epstein-Barr virus, or EBV. It's usually found in young adults, and it's known as the kissing disease because when someone who has infectious mono kisses someone else, they transmit that by saliva, and then they will get sick and have the virus as well. Symptoms for mono, and many of you may have already had mono, unfortunately: sore throat, fever, enlarged cervical lymph nodes. If you remember, those are in your neck. Gingivitis, which is inflammation of the gums, headache, tiredness, loss of appetite, also known as anorexia, and general malaise or a rundown feeling. Now, there aren't any antibiotics that will treat this because it is a viral infection. It is not a bacterial infection. So this is a disease that just has to run its course. We tell patients to go home, make sure they're very hydrated, they rest, and they eat well. This can go on for long periods of time. Chronic mono can go on for months. Typically, 2, 3, 4 weeks is what we typically see, but it could go on for a longer period than that. Oncology that we see of the blood, lymph, and immune system. Leukemia. You guys have all probably heard of leukemia, and if you break it down, emia is blood condition, leuc is white. So this is an overgrowth or an abundance of malignant white blood cells. And so the body continues to kick out white blood cells from the bone marrow to the point where there's way too many in the blood. A typical white blood cell count is maybe like 10 to 15,000. And so in a leukemia patient, we'll see 80, 90,000 blood cells. So a huge overgrowth. This can be acute or chronic, and if you remember what those are, acute means sudden onset, short duration, and chronic means a condition that is long-standing. Diseases and conditions that you need to know for the quiz on page 275. The first term is hematoma. Hematoma is just a fancy name for a bruise. It is a local accumulation of blood, usually clotted in an organ, space, or tissue due to a break or severing of a blood vessel. Lymphadenopathy, you can break this term down. Pathy means disease, lymph means lymph, and adeno means gland. So this is any disease of the lymph nodes. And then sepsis. Sepsis is a term that's used to describe presence of bacteria or their toxins in the blood, also called septicemia or blood poisoning. And if you remember, this is a systemic infection. When we talked about the difference between localized and systemic, sepsis is definitely a systemic infection because if your blood is infected, then your whole body is infected because the blood's going to all parts. Diagnostic and therapeutic procedures to know from page 278. The first one is bone marrow aspiration. If we have a patient that has an unknown blood dyscrasia that we can't diagnose, a bone marrow aspirate is needed to be done. And so basically, they show a picture on 278 of removal of a sample of bone marrow using a thin aspirating needle. And then they send it for microscopic examination. So it's basically using a long needle, going down and puncturing the femoral head of the bone, and then taking out some of that spongy portion of the inside and sending it for a pathologist to look at. Over to page 279, the term complete blood count is a very routine blood test that's used to check to see if a patient has adequate hemoglobin, hematocrit, adequate levels of red blood cells, red and white blood cells, their platelet count, and then they look at the blood slide underneath a microscope to detect any possible abnormalities. And then transfusion. You need to know the difference between an autologous and a homologous transfusion. A transfusion is just an infusion of blood or blood products to another person. An autologous transfusion is infusion of one's own blood. So this would be if I knew I was going in for an elective procedure like a hip replacement. I could go in a month before and donate blood, and then they, at the time of surgery, if I became anemic and needed blood, they could get the unit that I donated previously and give that back to me, so I wouldn't receive anyone else's. So that's something that some patients like to do if they know they're having an elective surgery going in. A homologous transfusion then is an infusion of donor blood. So someone has given their blood to the blood bank, and then when you go in for surgery or you have a problem that you need a transfusion, you're transfused someone else's blood that is specific to your blood type. Abbreviations to know for the quiz on page 282. The first one, AIDS, stands for Acquired Immunodeficiency Syndrome. CBC stands for complete blood count. HB or HGB stands for hemoglobin, which is the oxygen carrying capacity of the blood. HIV stands for human immunodeficiency virus. And RA, your book says, stands for right atrium and rheumatoid arthritis, but typically you see it as rheumatoid arthritis. Spelling words you need to know for the quiz: hematoma, lymphadenopathy, hemoglobin, leukemia, rheumatoid arthritis, edema, hemophilia, and septicemia. You are responsible for memorizing the word elements and their meanings on pages 265 through 270. That's where you're going to make your flashcards and study the combining forms, prefix, suffix, and their meanings. You will see that there are some new suffixes and new prefixes in this chapter, so make sure you pay attention to those. This ends the recording of Chapter 9, Blood, Lymph, and Immune System.